I was researching and I realized that many of the cases that are being detected in children of the COVID and of the Omicron are incidental in nature. Can you elaborate on that? What is incidental?
Yeah.
How are the doctors going about detecting the COVID in kids?
So that's a good question. So incidental means I'm admitting you for tonsillitis, or I'm admitting you for pneumonia, or I'm admitting you for diarrhea in the hospital.
Okay.
We've got a policy that each and every patient being admitted must get a test. So if you're then positive, they say you have COVID, but that's not the reason why that's incidental. That's not the main reason why you are there. And so they use that stats now to sort of scare people and say, no, children are getting very sick. No, it's incidental. You know, there will be children that's only admitted for COVID, but then they are the minority of children.
All right, so it's not...
And they are sick.
They are sick of some other issue as well that they have been facing. And Dr. Coetzee, just a few questions more. I understand you'll have to leave. You must be very busy. One of the questions I do have in mind is that at this point, because India is looking at South Africa primarily of how is it developing there. And there was this term that went on with the Omicron, that is the variant of concern. Do we stay on with that? Do you think that is important that we consider that so that we do not let the guard down? How is South Africa observing and tracking the Omicron?
So it should always stay a variant of concern. You should never take your eye off the ball, not with these variants. So what South Africa is doing, and this is to create awareness under the public. Please go and get tested. If you wake up with a sore throat or a headache or whatever, go and get tested. So just for an example, yesterday we had 73,911 people tested and 19,800 was positive.
Okay.
So we've got a lot of people going to test. So the positivity rate is nice. It's a 19,000. But do we see all those sick people coming into the surgeries, overflow the surgeries? No, not really. We can handle. This is not the same at primary healthcare level than Delta. Delta is a dangerous virus.
It is. And so therefore, because India has already witnessed that very tragic second wave, there were a lot of casualties at that point. What advice would you like to give to India, the government, the public at this point to ensure that we do not see a return of that, even though, of course, now many people and of a fairly high level are now vaccinated with either a single or both doses?
I would say, please look at your programs. Look at your death rate among children. Always understand that children will be the fast or the super spreaders, with schools and that taking the virus back home. Look at that. Look at your data. If it's necessary, get the children vaccinated. But more important, get as many jabs in the arms of the vulnerable people, the people above the age of 50 and 60. Go for the boosters as much as you can and try to get people, if they go and they need to do 2 jabs, they have to continue and they have to make sure. Otherwise, you're not fully vaccinated. So it doesn't help you go for 1 jab and you're supposed to go back for another and you never go. Then it's as good as you're not vaccinated.
And does our safest bet remain the wearing of the mask and keeping a bit of a distance with another person?
Yes, it's so important. And that actually costs nothing except the mask that you maybe pay for. And I keep on stressing, please use a clean mask every day. No use to wear the mask that's 5 days old.
Okay.
There's no value.
I think that's a very important reminder because it's been so many months already. Dr. Coetzee, just before I let you go, anything specific that South Africa is looking at, is tracking to ensure, perhaps because studies are still underway, is there something that you're focusing on and waiting for a result there while you're studying these patients?
Yes, we are looking with concern and waiting to see what is going to happen in ICU, in hospital cases. That's the only thing. primary healthcare, we sorted. We're fine.
All right. With that hope, perhaps, and many people who are listening and watching this interview, I hope they've got some very incredible points. As always, Dr. Angelique Coetzee, thank you for your time and wishing you all the very best. And